Many people talk about the rotator cuff, and of course we see lots of rotator cuff related problems within the clinic. But what actually is the rotator cuff? Well, let's take a look. So here we have our in-clinic model, looking at the front of the right shoulder. The rotator cuff is made up of 4 muscles and their tendons that essentially give the ball and socket joint of the shoulder a hug, and they dynamically stabilise that shoulder, even when you're just standing at rest. Here we can see all 4 of the rotator cuff muscles and their tendons attaching around the humeral head and attaching into some tuberosities or prominences of the bone. Let's dive in a little bit deeper. So here we have the glenohumeral joint, or the ball and socket joint, made up of the humeral head and the glenoid, which belongs to the scapula or shoulder blade. Adding some layers in of the capsular membrane and ligaments of the shoulder at the deeper level, we can appreciate that 3D spherical appearance of the joint. Then if we add in the next layer, we see the rotator cuff. Again going round, lying on top of the capsular membrane. We have great experience of dealing with rotator cuff problems at LifeFit Wellness. This includes expert physiotherapy management. However, we also have the ability to perform diagnostic ultrasound scans to aid with your diagnosis and use ultrasound to guide specialist injection procedures as appropriate. If you have shoulder pain, think you might have a rotator cuff problem, don't hesitate to get in touch.